Now, as you all may know, October is Breast Cancer Awareness Month. Joining us is Dr. Jorge Darcourt with Houston Methodist Hospital. Dr. Darcourt, thank you so much.
Thanks for coming in.
Thank you.
First question out there. You know, there's been some controversy as to when should we have a mammogram? Well, what do you recommend?
Well, nowadays we're recommending having mammograms at age 40 to 45. There's a little bit of controversy around it. But basically, we really enforce this on women that have a high risk for breast cancer, for sure. And they have to talk with their own physician, with the practitioners, or if they have questions, come to see us for our high-risk clinics to discuss these issues. General recommendation right now, around 40 to 45 years old for most women.
And Dr. Darcourt, I was going to ask, there are a lot of women who have a history of breast cancer in their family, perhaps their mother, a grandparent. How strongly does hereditary factors, hereditary factors play into someone's potential risk?
It's very important, and this came into the news for the case of Angelina Jolie that happened a couple of years ago. There was much more awareness about this. 5 to 10% of the cases of breast cancer that we see are going to be hereditary. But
much lower.
Wow.
Yeah, 5 to
much lower
10%.
than
But there's other cases, for example, of families that have red flags. For example, you have a family member that have been diagnosed with cancer before age 50. You have a family member with breast and ovarian cancer. You have a family member with male breast cancer. That can happen. And those are red flags. Or you have 2 or more family members with breast cancer. You have to think, well, maybe I'm a high-risk patient, and I should go to see my physician to get an earlier mammogram.
When you say family members, that includes what, your immediate family, but that does also includes grandparents as well?
Both.
Okay.
Yes, the immediate family, that means your mother, your sisters, your brothers, but also your grandparents and even your cousins. You know, sometimes we discover cases of hereditary breast cancers because of the family history of the cousins or the aunt or the uncle. So it's very important that every single woman discuss their family history of cancer with their physicians. And if there's a red flag, say, well, maybe you have to go to one of the high-risk clinics that we have or talk to an oncologist.
And it's interesting that you say we should also know the family history of our uncles and fathers and grandfathers, right? I mean, do a lot of women overlook that fact that they shouldn't just be focused on females?
A lot of women, a lot of men, a lot of us, they don't know our family history. We don't know it, and it's a very powerful tool. You know, knowledge is power, and the more we know about our families, the more we know about ourselves.
Of course.
What are some tips for women?
Well, current tips right now are self-breast examination is something that we recommend still once a month. It's important. Doing a mammogram once a year is important, particularly on the younger age group, and particularly if you have high risk for cancer. And other things that we can do, because a lot of women come to see me and say, well, what can I do besides the fact that you can do a mammogram to diagnose cancer early or before it becomes an invasive cancer, but doing diet and exercise has been recommended by most organizations, has been proven to decrease the chance of having breast cancer. Right now, we have an epidemic of obesity in this country, unfortunately, and doing diet really decreases the chance of having breast cancer. And when you have breast cancer, decreasing your weight, decreasing obesity, improves the outcomes. People live longer. So it's a very powerful tool.
Dr. Darcourt, there are a lot of new things we're learning from clinical trials. Tell us about that.
Well, we do have clinical trials for treatment of cancer, and we do have clinical trials for prevention of cancer. Right now, we have a clinical trial, for example, in our high-risk clinic with olive oil. Who knew? And this is something that we're doing a compound that is an extract of olive oil, and we're trying to prevent cancer on women that are believed to be at high risk to develop breast cancer.
You're kidding?
Yes. It's
using olive oil.
Well, it's a more concentrated, and it's led by Dr. Dea Capella at the high-risk clinic, and we're having a lot of women enroll in this trial. And we also have trials with treatment for breast cancer. We are giving less and less chemotherapy right now, much more targeted therapy. And this is the most fascinating time for treatment of breast cancer. We have better outcomes with less toxicity.
So are you seeing more breast cancer cases now or less than, say, 10 years ago?
Well, that's a good question. In general, if you look at the incidence, you will see that we are detecting more breast cancer. We are living longer. We have more diagnostic studies, and we are detecting it better. But the mortality has decreased significantly.
Oh, that's great.
It has
That's
been
great
successful.
news.
So we have decreased the mortality from breast cancer in the last several years.
Houston Methodist has multiple locations in and around Houston, right?
Yes, we have our main campus location in the Houston Medical Center, but we have a breast cancer center in Woodland, we have it in Willowbrook, West Houston, we have it at Sugar Land as well. St. John's, and in the Baytown area. And it's important because all of these locations, they have a breast center. We have a team of genetic counselors. We have a high-risk clinic where women can go, ask questions, and be seen or treated if necessary.
And even with all of the progress we've made, still, if you are a woman, it is the most commonly diagnosed type of cancer in women, and it's the second leading cause of death. Is that right?
Yes. 1 out of 8 women will be diagnosed with breast cancer at some point in their life. There's 235,000 women to be diagnosed with breast cancer this year in the United States.
And you guys have an upcoming event, right?
Yes, we do have one on the West Houston area, on Katy, on La Centerra. We have an event for Breast Cancer Awareness Month. We invite everybody to go there.
We're putting the information on the screen right now. That's Friday, October 21st at 6 p.m.
That is today.
Positively Pink.
Yeah.
All right. Well, thank you so much.
Thank you so much for coming in. And to learn more about Houston Methodist and their breast cancer care services, you can schedule a mammogram by visiting houstonmethodist.org/fightbreastcancer.
Thank you, Dr. Darkworth.
Thank you.